questions. Hello, everyone. I'm here today with Shona Curley. Shona, where do you live?
I live in San Francisco.
Oh, you live in San Francisco. Great.
Yeah.
So Shona has Lyme disease, which I think a lot of people in the Bay Area have found out they have. Is that correct?
I'm not sure percentage-wise, but I know it is here.
I think it is. Yeah, I don't know percentage-wise, but I hear about a lot of cases from like the parks you have and that stuff like that.
Yeah, for sure. I got it in the Bay Area. Yeah.
Okay. Yes, and tell us a little bit more about your background. You were just telling me you own a Pilates studio, but maybe what people traditionally think about that. Yeah, it's a little different.
Before I got Lyme and started working with Lyme disease in particular, back in my 20s and 30s, I was a modern dancer. That was my main focus. And I taught Pilates. I've been teaching Pilates for 20 years, but I started teaching just as a kind of an adjunct to my dance career. And I taught a lot of dancers and people that were, in the professional dance field back then.
Cool.
But then I had a pretty severe injury, which actually now I wonder if there wasn't some kind of chronic inflammation in my system even way pre-Lyme, because it was so resistant to treatment. It was a super, super stiff and painful neck and shoulder that it didn't matter what I did or said, it just would not go away. And honestly, it didn't go away until I changed my diet due to Lyme disease, which is, a nice side effect. But because of that injury, I started getting trained in injury rehab, and some of the rehab tools really helped me, although none of them completely got rid of the pain because, I just didn't know at the time it was so inflammation based. I thought it was just a structural problem because that was how I had been taught to look at the body up to that point, So anyway, it was nice to get trained in rehabilitation and seeing the body structurally through that lens. And I worked with, back starting in my probably early 30s, started working with people with chronic pain and injuries through movement, through Pilates-based movement and like PT-based rehab. But then when I was like 41, I was bitten by a tick and kind of slowly got sick and eventually got diagnosed with Lyme, and then began this whole discovery process of the disease process itself, whether it's Lyme or anything else, the inflammatory process that the body can go through, the detoxification pathways and how important it is to have them up and running, diet and how that can support health, meditation and movement, how that can support health. So now I look at the body not just as a structure that needs to kind of be in the right place and balanced, but also as a structure that needs to be supported by the fluid systems and the organ systems and a kind of a balanced microbiome, et cetera. So more kind of through a functional medicine perspective and less through a movement perspective.
Yeah. I want to share a little similar story I have because maybe it'll reinforce for anyone watching. Like I had chronic mid-back pain for many years before I found out I had mold toxicity. And now looking back, like you said, I was like, because it's the same, it's just like always sore. And I changed my diet too, seeing a PT, seeing this, and then frankly, like the practitioners would be like, oh, well, you're probably just too stressed.
That's what they always say.
Yeah. It's like, no, it's your fault. Actually, I couldn't fix you. It's your fault. So now I look back and I'm like, I probably had that chronic inflammation because of mold. That was my warning sign long before some of the other things started to build up. So just for anybody watching, if something doesn't make sense in your body, there's probably some other angle going on that you haven't thought about or addressed. And I think toxicity is a big one, whether Lyme disease or mold or autoimmune disease. So, continue to be curious if you feel like something's off that, you're not getting an answer for. Would you say?
Absolutely. Yeah.
Yeah.
Okay, I think toxicity is a part of any kind of imbalance in the body. Like at this point in our world, you got to look at it.
Yeah. So I was talking to you before we came on, and I'm going to test myself for Lyme just out of curiosity because it goes with mold a lot. And I'm starting to become a teensy tiny bit Lyme literate, like 1% of the path. But if people are watching and they're also like, well, what is, how common is this Lyme disease? Could I have it? Maybe talk a little bit more about, and now you see a lot of people with Lyme, talk about the symptoms, how it can be diagnosed, that kind of a thing.
It's difficult to diagnose, and the symptoms range over a vast terrain. So it's not easy to know if you have Lyme disease. I would say if anyone is wondering, online, you can look up Richard Horowitz, MD, has an online quiz that you can take, and it doesn't take very long. You just score yourself through a whole bunch of questions, and then if your score is in a certain range, he scores you as like highly likely to have Lyme, or kind of moderately likely, or not so likely. So I took the quiz. It was like checkity, check, 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 like every box.
So then you probably didn't need to test after that, but did you test? Yeah. No, it's nice to know. You know, if you're going to go about treating something that's so big, you want to know, right? Yeah. Okay.
But he's a pretty well-known Lyme doctor, and his opinion is that it should be a clinical diagnosis, not a testing diagnosis, which is interesting. And I know not all doctors share that opinion, but I think there's a certain amount of real truth to that, in my feeling, just because when you get a test, you're testing for Borrelia burgdorferi, the one bacteria that we've isolated that's a contributor to Lyme disease. But there are literally hundreds of species of Borrelia that you could possibly have, and hundreds of species of co-infections that ticks also carry. So to test yourself for that one bacteria and let that determine your diagnosis, right now, our testing is just not quite up to the standard that the disease is setting for us, basically.
Right.
But okay. Clinical testing really is, in terms of an intelligent doctor asking intelligent questions and looking at a broad spectrum of symptoms, and then your response to treatment, you know, that's another factor. Do you respond to treatment?
Yeah. Okay. Yeah, that's helpful. I mean, this company I'm going to start with, they said it's like pretty accurate now, like 90%, but you're right, it's not all the strains. It's
right.
Like
there's just many strains. That's I think that, in Richard Horowitz's opinion, as far as I understand it, that's the downfall to a clinical, that's called not a clinical diagnosis, but a testing diagnosis.
Okay. I'm just looking at his quiz. It's like you have to write it down on your own piece of paper. It looks like it doesn't like.
Okay, maybe.
Well, like it doesn't look like
print it out.
Look, you can't. I thought it would be like you could click.
You could do it online, yeah. I don't remember.
I don't see it that way, but I can motivate later.
Yeah.
Okay, so I want to talk about how you work, because it sounds kind of unusual in a good way. So you use visualization, meditation, movement, and I guess what I would call like passive movement, like you're doing
hands-on body work.
Body work. Yeah. So yeah, a lot of people, when they think about Lyme, they think, okay, medication and herbs, and they don't think of that. So first of all, why should we be thinking of things like body work and visualization?
Because it's such a long process. Once you decide that you're going to treat yourself for Lyme, it's not like 2 months later you're going to be fine. It's a long life process of figuring out which treatments work for you, moving gently with your body and letting things evolve over time, and changing your lifestyle to accommodate healing. And in my personal experience, I needed mental and emotional support for that. And I also needed, you know, and movement and bodywork actually was mental and emotional support for me, as well as a concrete physical support
too.
Yeah. So I needed I used people who did craniosacral work and different fluid movement work to just one of the really big problems with Lyme disease is the drainage pathways becoming clogged up, whether it's lymph or even blood flow, especially in the brain, or the liver detoxification pathways, or just whatever. Like any fluid system that's trying to cleanse your body is going to have a hard time with Lyme, because the bacteria create toxicity when they die or by living. So they're creating kind of a mess in your system, and your body is continually trying to clean that up. So it just gets backed up. It gets a backlog, and then a lot of the symptoms, in my opinion and in my personal experience, are from the lack of flow in your various different detoxification systems.
Oh yeah, I'm a big fan of that. I haven't done some of the things you described, but I've done lymphatic massage when I was the sickest. I've done the trampoline. I do dry brushing. I tell people dry brush all the time. I've done essential oils. And I think there's still so many more tools beyond that, is what you're bringing up today. It's so simple, but it does help.
support your body in moving the fluids through as it processes the bacteria. Yeah.
Okay.
And as it processes the herbs and drugs that you might have to use also, you know, they have their own, you have to clear them too, especially if you're using antibiotics.
Okay. So I want to talk to you next about like visualization, but I'll just say if people are thinking about, well, maybe I want to try some of this body work, do you recommend any self-study tools or a certain type of practitioner they go find?
There is a technique called integrative manual therapy. You can look that up. Usually people are quite well trained in feeling organ systems, feeling fluid systems, if you look up that kind of training.
Okay.
I also think craniosacral work is really beautiful. It works on the cerebrospinal fluid in the brain and spinal cord primarily.
Oh, great. I love craniosacral.
Yeah, so you could start with looking for those two kinds of practitioners. And you know, just ask people, how do you work with the lymphatic system? Do you work with the lymphatic system in the brain? Do you work with the liver and kidneys? You know, can you help me with drainage and toxicity?
Okay, and we posted your link in the notes. Are you taking new clients too?
I have a few openings, not that many, but I have a few.
Okay, okay.
I have one person moving.
Okay. So I'm very curious about the visualization. Just tell me how you approach all that.
Okay. Well, before I knew I had Lyme, I used visualization to help myself feel better. And because my background is in dance, I also have a background in visualization through movement. Basically, as a dancer, you know, you give yourself different things to think about and it changes the quality of the movement. So, and one of the techniques I was trained in is body-mind centering, which was invented by a woman named Bonnie Bainbridge Cohen, who's one of my heroes, goddesses. And she uses any system, any physiological system in the body, or even let me say this wrong, the development of the embryo. She'll even use parts and pieces of development at that point in the human history to generate movement ideas.
Wow.
And she also is a hands-on practitioner and does healing work with people, working on all of these, you know, any system in the body. She's just a genius.
Wow.
So I haven't studied with her directly, but I've studied with people that have studied with her, and I've watched a lot of her DVD training programs. And initially I used it to generate choreography or to generate improv-based dance work. But then eventually when I started doing more rehab work and movement work with people, it's nice to be able to feel into whatever layer, you know, it's not necessarily the muscles that are the problem. Sometimes it's the fluid in the joint space. Sometimes it's the fascial adhesions between the psoas and the diaphragm. So you want to be able to see through somebody's body and see what's preventing them from moving freely, and also be able to feel it in a hands-on way. And, you know, I just find that stuff and never-endingly fascinating. You know, there's always something to learn. The body is just so much more complicated than, I think I can get to like age 97 and still not really know anything. Still feel like I'm at the tip of the iceberg.
Yeah, there's so much to learn.
Yeah, I started using, I couldn't really move so much, right? I was super sick, so I couldn't really exercise, but I could lay around and visualize. And so I started going pretty deep, and I started watching more of Bonnie's DVD programs and getting into the nervous system, getting into the endocrine glands, and just imagining and feeling into them. And none of it has to be perfect or exact science. It's, you let the imagery come to you, you work with whatever imagery actually produces feelings in your body that you find pleasurable. There's a lot of freedom and a lot of sort of artistic license with visualization. So it worked just so amazingly well for me. It would relieve my anxiety. It would relieve a lot of my symptoms if I just spent a half an hour lying in bed focusing on one system or another that I felt like needed my attention. So eventually when I got diagnosed with Lyme, I realized I was not the only one who was having a hard time exercising and could benefit from visualization in this way. So I wound up collaborating with a partner in writing and recording 6 different meditations that focus on different physiological systems that need support when people have Lyme. So those are on my website, and that's my way of kind of working beyond just my tiny little private practice and putting my work out there for more people than I can see in person.
Oh, cool. I'm going to go to your website and check it out right now. And you gave us a discount code too for some of the meditations. Are these the meditations you mentioned the same as the visualizations, or is that something different?
Basically, yeah, I think of them as basically the same thing. Yeah.
Okay, perfect. Okay. So there's often on like the body systems that you're visualizing on and moving. Is that right?
Say that one more time.
So the visualizations are sort of about the body
Yeah, there's one that's liver detoxification and kidneys and skin. There's one that's lymphatic flow. There's one that's the limbic system, the vagus nerve, and the enteric nervous system in the gut. So
wait, I need to talk about that one. Okay, so I've been talking about the vagus nerve to some folks because I get people who are really chronically constipated for a long time. And, you can just kind of get a sense like the body doesn't know how to have that movement.
Yeah.
So I've been giving people some links about it, but I'm also like, I don't really feel like I'm that confident that it will work in a sense because it's just like, I don't know if reading different things is enough. Like, I think it needs to be like a system. So, okay, so which one is that? I'm looking at your
That's the anxiety relief.
Okay, calming the limbic system. Okay, whoops. Okay, so there's like some little samples of that.
Yeah, there's 1 minute samples that you can listen to. It's also, the whole project is on iTunes also.
Okay, and that one is only $4 for the anxiety relief. Okay, so I can give people this one too. So this one has the vagus nerve in it too.
It does, yeah.
Okay.
And personally, I find it extremely helpful. I have had a certain amount of anxiety my whole life, and it was like horrible when I got Lyme. It just went through the roof. And this meditation actually really, really helps me.
Okay, I think I might buy a couple of these because I definitely deal with anxiety. And then you've got one on detox, lymphatic flow. I mean, I need probably all these. I mean, when you're in a, lots of people do. When
everybody does, honestly. Like everybody needs help with all of those systems. Yeah.
Okay. Oh, and then one of them has all of them.
Yeah, you can buy the whole album.
Buy that one. Right. Okay, that's only $16, you guys. And
it's on iTunes too. If you buy it from my site, you get a slightly better sound quality because the files are bigger.
Oh, really? Okay.
But if you buy it from iTunes, you can download it right to your phone.
Okay, so this is Red Kite Meditations, everybody, but we're putting her main link in the notes. So Red Kite Meditations. Yeah, I mean, that's a great deal for all these meditations, It's
a lot. It's like hours and hours. Each one is about 20 minutes. So it's it's a lot of listening time.
That's great. I didn't want to get this. This sounds really great. Well, thank you for making this like affordable and just like easy because a lot of people have trouble even meditating,
I have trouble meditating. It's hard.
Yes. It's hard to sit down and be like, okay, now we're meditating. But if you have like, okay, I'm going to run this track and I'm going to feel less anxious when it's over.
Yeah.
Come on.
Yeah.
Come on.
It's way easier and it still trains your brain. In my opinion, it still counts. You still meditate.
Oh yeah, definitely. I mean, often in a lot more effective way. Unless you're really skilled at meditating, it's kind of hard to meditate with no,
Yeah. Nothing to pay attention to. Yeah.
Yeah. Well, thank you so much. This was super interesting. I'm really glad we talked.
Thanks. If people want to buy the album on iTunes and not deal with my site, the title of the album is The Cell's Breath.
The Cell's Breath is the album. Okay. And then there's a little coupon code we gave if you want to come. Just buy all of them. Just buy all of them.
The coupon code will only work on my site, though it won't work.
Okay, right. iTunes won't let you in there. Okay, so I'm seeing it. And then you just click through to the whichever one it is. Awesome. This is so great. Well, I really appreciate your work. I'm glad you're feeling better, right?
Almost 100%, not quite. A little, still have little, ups and downs, but.
Wow, well, how long has it been?
I was diagnosed 1.5 years ago.
Well, that's not even that long.
Honestly, it's true. It's true.
You're doing really well.
Yeah.
That's great. Yeah.
I've also been hardcore. Like I've been after it.
Yeah. You don't seem hardcore. You seem like super relaxed and grounded. So that's why I got to do your meditation.
Thanks.
All right, everyone, go ahead.
I'm nothing. It's okay.
So this has been Shona Curley, and the website's Red Kite Meditations. We've got it on the link. So if you're dealing with chronic illness, anxiety, or Lyme disease, go check out her stuff. And Shona, again, I appreciate you coming on.
Thank you so much for having me.